Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Shingles, also known as herpes zoster, is a painful viral infection. It is caused by the varicella zoster virus. This is the same virus that causes chickenpox. After a bout of chickenpox, the virus stays dormant in your body. It can reactivate later in life, causing shingles. Shingles usually appear as a painful rash on one side of the body. The rash develops into fluid-filled blisters. These blisters typically scab over within 7 to 10 days. Shingles can last for 2 to 4 weeks. For some, the pain can linger for months or even years. This is known as postherpetic neuralgia. The varicella zoster virus lies dormant in the nerve cells near your spinal cord. When it reactivates, it travels along nerve fibers. This causes pain and a rash in the area supplied by that nerve. Shingles is not contagious. However, a person with shingles can transmit the varicella zoster virus to someone who has never had chickenpox. Transmission occurs through direct contact with the fluid from the blisters. Anyone who has had chickenpox can develop shingles. However, some factors increase your risk. Age is a significant factor. Your risk of shingles increases as you get older. A weakened immune system can also make you more susceptible. This could be due to conditions like HIV, AIDS, diabetes, or cancer. Certain medications, like chemotherapy drugs, can also weaken the immune system. Chronic stress, recent illness, and even something as simple as a cold can trigger shingles. These factors can temporarily suppress your immune system and gives the virus a chance to reactivate. Certain medications, known as immunosuppressants, can increase your risk too. These medications are often used to prevent organ rejection after a transplant. Shingles typically starts with pain, burning, or tingling sensations on one side of the body. This is followed by a red rash in the same area. The rash quickly develops into clusters of fluid-filled blisters. The pain associated with shingles can range from mild to intense. Some people describe it as burning, stabbing, or shooting pain. The affected area of the skin can be extremely sensitive to touch. Besides the rash and pain, shingles can also cause other symptoms. These include fever, headache, chills, and fatigue. In some cases, people may experience upset stomach and light sensitivity. The rash most commonly appears on the torso, but it can affect other areas. It can develop on the face, including the forehead, and around the eye. If shingles affects the eye, it can lead to vision problems. Diagnosing shingles is often straightforward. Doctors can usually diagnose it based on your medical history and a physical exam. They will ask about your symptoms, including the location and duration of the pain and rash. The appearance of the rash is usually characteristic of shingles. The fluid-filled blisters arranged in a band on one side of the body are telltale signs. However, in the early stages, the rash may be subtle. If the rash is near your eyes, your doctor may refer you to an ophthalmologist. Shingles affecting the eye can cause serious complications. While lab tests are not usually needed to diagnose shingles, they can be helpful. Your doctor might order a viral culture or blood test. This can confirm the diagnosis, especially in atypical presentations. There is no cure for shingles, but early treatment can help. It can shorten the duration of the illness and reduce the risk of complications. Treatment usually involves antiviral medications, pain relief, and other measures to relieve symptoms. Antiviral drugs, such as acyclovir, valacyclovir, and famciclovir can help fight the virus. These medications work best when started within 72 hours of the rash appearing. Pain relievers, such as ibuprofen or acetaminophen, can help manage the pain. In some cases, your doctor may prescribe stronger pain medications. These might include narcotics or tricyclic antidepressants. Other treatments may be recommended to relieve symptoms. Calamine lotion or cool compresses can soothe the itchy rash. Wet compresses can also help dry out the blisters. Most people recover from shingles without any long-term problems. However, shingles can sometimes lead to complications. These can range from mild and temporary to serious and long-lasting. Postherpetic neuralgia, or PHN, is the most common complication. It causes persistent pain in the area where the rash was, even after the rash clears. The pain can be severe and debilitating, lasting for months or even years. Shingles can also affect the eyes, especially if the rash is around the eye. This can lead to vision problems, including blindness in severe cases. Other potential eye complications include conjunctivitis, keratitis, and uveitis. In rare cases, shingles can spread to other parts of the body. This is more likely in people with weakened immune systems. Disseminated shingles can affect internal organs and can be life-threatening. The best way to protect yourself from shingles and its complications is to get vaccinated. The shingles vaccine, Shingrix, is recommended for adults age 50 and older. It is also recommended for adults younger than 50 who have certain risk factors. Shingrix is a 2-dose vaccine, given at least 2 months apart. It is highly effective at preventing shingles and PHN. Studies have shown that Shingrix is more than 90% effective at preventing shingles in adults 50 and older. The vaccine works by boosting your body's immunity to the varicella zoster virus. Even if you have had shingles before, you can still benefit from the vaccine. It can reduce your risk of having shingles again. Talk to your doctor about whether the shingles vaccine is right for you. If you have shingles, there are things you can do to manage the symptoms and make yourself more comfortable. These include home remedies for symptom relief, ways to prevent spreading the virus, and strategies to cope with the emotional toll. Keep the rash clean and dry. This can help prevent infection and speed up healing. Apply cool compresses or calamine lotion to the rash to relieve itching. Wear loose-fitting clothing to avoid irritating the affected area. Avoid scratching the blisters, as this can increase the risk of infection. If you have blisters on your face, be careful not to touch your eyes. Wash your hands frequently with soap and water, especially after touching the rash. It is important to manage stress, as stress can weaken your immune system. Engage in relaxation techniques such as deep breathing exercises or meditation. Get plenty of rest and eat a healthy diet to support your body's healing. Shingles is a common yet potentially debilitating viral infection. While there is no cure, understanding the causes, symptoms, and treatment options empowers you to take control of your health. Early diagnosis and treatment are crucial for managing symptoms and preventing complications. Prevention through vaccination remains the most effective way to safeguard yourself against shingles. If you are 50 or older, or if you have risk factors such as a weakened immune system, talk to your doctor about the shingles vaccine today. If you found this video helpful, give it a thumbs up and don't forget to subscribe, like and share for more health tips. Thanks for watching.